Alright, greetings to everyone. Today's presentation is on female reproductive system, and this is part of our e-learning program. So let's look at the details of the female reproductive system. The reproductive system of a female are those which are concerned with copulation or sex, fertilization, growth and development of the fetus and its subsequent exit or delivery into the outer world. The female reproductive system is made up of three main parts. We have what we call the external genitalia, the internal genitalia, and we also look at the accessory structures involved in the process of reproduction. Now, the accessory structures support the process of reproduction, and we are going to look at how this supports. Now, we want to start with the external genitalia or the vulva, and is also known as the prudentum. Now, the female external genitalia, we look at that part of the female reproductive system which can be observed with the naked eye, which can be observed from outside. And this is also during vulvar swabbing, we clean the female external genitalia. We all know the procedure of vulvar swabbing. Now, the female external genitalia or the vulva, the appearance and in terms of size and shape varies according to age and the number of children a woman has given birth. For example, if someone is still young, the size of the external genitalia is also small, and it keeps increasing with age, but as a female goes into menopause, the size decreases. Then the color varies according to heredity and race. Now let's look at which structures consist of the vulva or the female external genitalia. One of them is what we call the mons pubis, commonly known as the mountain of love, labia majora, labia minora, the hymen, the clitoris, the vestibule, urethra, and what we call the Skin's gland. Skin's gland is also known as, we're going to look at the alternative name, Bartholin gland, and then the vestibular. So the diagram we're having here is of a female external genitalia. We talked of the mons pubis. Mons pubis is made up of a pad of fatty tissues, connective tissues, on top of the symphysis pubis. It is covered with hair from puberty. And then we have the labia majora on either side. The labia majora is made up of a fold of fatty tissues. The outer surface is covered with the skin containing hair follicles. The inner surface is made up of stratified squamous epithelial cells with sebaceous gland, rich in sebaceous gland, which produces oily secretions, and then it extends downward to insert itself within the perineum or the perineal body. The labia minora is also a fold of skin which is located within the labia majora. It is devoid of hair follicles. It is not having hair. It is smooth like a mucous membrane, and it also extends, the lower hand extends downward to meet at what point we call the faucet. In between the labia minora, we have a boat-like depression. When you see this structure, is boat-like shape. So it is called the vestibule, and within the vestibule there are openings. One of the main opening is actually the vaginal opening. At the sides of the vaginal opening, we have the vestibular gland opening, or the opening of the vestibular gland, or the Bartholin ducts. The opens here. And then we have the urethral orifice or opening, or the urethral mucus. Mucus means an opening. And also at the sides of the urethral mucus, we have the paraurethral glands or the Skin's glands opening. So those are some of the openings within the vestibule. So, and there is a space, there is an angle between the vaginal orifice and then the fourchette. This angle here is called fossa. It is fossa. It is a fossa, and it is actually called fossa navicularis. So fossa navicularis is this space between the vaginal orifice and then the fourchette. And then another structure we'd want to look at is the clitoris. Clitoris is in between the labia minora. The clitoris is homogeneous to the male, homologous to the male penis. It is made up of erectile tissue, what we call the corpora cavernosa, and it is an area of heightened sensitivity, sexual arousal. It produces a component called smegma, which is believed to be sexually arousal to women. It is also to men, and it is also having what we call the prepuce of the clitoris, just like the prepuce of the penis, and the glands of the clitoris. And then, so those are the main structures which are visible. The hymen covers the vaginal orifice, but not completely. If a child is born with the imperforated hymen, when the hymen is closing the orifice completely, we call that condition imperforated hymen, and incision can be done to manage the condition so that the child can pass the menstrual flow out. Now, there is what we call the perineal body, and then the perineal region. The perineal region is a wedge shape. It's extending from the lower border of the vagina to the anus and measuring 4 by 4 centimeters, like that. So this is the perineal area, and we shall look at the details of the perineum later. So pushing on, say the mons pubis is made up of a part of subcutaneous tissues, and it is found at the anterior abdominal wall, covers the anterior portion of the symphysis pubis. We have already discussed about that. Labia majora, say there are 2 thick folds of fatty tissues covering externally by the skin, and the inside is covered by stratified squamous epithelial cells. But what I want you also to appreciate, the inner surface of labia majora for nulliparous women is moist and looks like a mucous membrane, whereas for a parous woman, a woman who has given birth to many children, they become skin-like and dark in color. So all this one we have already discussed. The fossa navicularis, we have already talked about it. The labia minora, the clitoris, the vestibule, the board-like depression with the openings, the vaginal orifice, the 2 skin ducts opening, then the opening of the Bartholin ducts, and the urethral meatus or opening, all those ones we already discussed. The hymen, the perineal body, we said is wedge shape, mass of fibromuscular tissues, and it is measuring about 4 by 4 centimeters, found between the lower part of the vagina and the anus. So the perineum is the superficial area between the anus and the vagina. So that is what we call the perineum. This diagram shows to us clearly the perineum, if you can see, extending right from the vagina to the anus, and is wedge shape, measuring 4 by 4 centimeters. what are the blood supply to the female external genitalia? So the blood supply, the female external genitalia is supplied by prudental arteries, which is a branch of femoral artery. You know about the femoral artery. And then the venous drainage is through the corresponding veins, that is to say prudental vein. Lymphatic drainage, the lymphatic fluids are drained into inguinal lymph nodes and then the external iliac lymph nodes. And then the nerve supply is through the prudental nerve and perineal nerve. We can do prudental nerve block as part of the providing local anesthesia during procedures at the external genitalia. So why is it that as a midwife, understanding the anatomy of the female external genitalia is important to you? So one, the knowledge of the female external genitalia can help the midwife to perform episiotomy without causing damage to the Bartholin gland. Remember, the Bartholin gland produces secretions which helps to lubricate during sexual intercourse. And then the clear knowledge of the female external genitalia also helps in the process of catheterization with minimum infection. So you are able to allocate the urethral meatus and insert the catheter without difficulties. That helps to minimize the risk of infection. As a midwife, you will also be in position to identify or to make diagnosis of a button-holding perineum or a perineum which is too tight to allow the presenting part to descend. This is common in elderly prime gravida. So these are the three main reasons for studying the external genitalia to you as a midwife, and that tells us why you really need that.